Is that my computer? Are you hearing that static, Pat?
Mm-hmm.
Good evening, everyone. We're going to get started. Welcome to March's edition of the X, Mary, and Pat Show, featuring Ms. Mary Fenner and Ms. Pat Boga, along with special guests on tonight. We are so glad that you are joining us on this evening from wherever you may be. And to the ones who will be watching this telecast later, thanks for joining in. My name is Thomas Robertson, but everyone just calls me Duke. I'm the Technology and Matrix Director for Oak Hill Regional Community Development Corporation, which is the parent corporation of Healthy Kids Mississippi. We recognize our board chair, Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. In addition to this Zoomcast, we are restreaming this evening's webinar on our Oak Hill Regional CDC and Healthy Kids Mississippi Facebook pages. Feel free to like and share on your social media pages. Also, feel free to post any questions or comments in the Zoom chat or in the social media comments. We will do our best to respond to each question. Our next Ask Mary and Pat show will be April 24th at 6 p.m. And we will make sure we give you those announcements again later on as this evening continues on. So without further ado, I will turn it over to the stars of the show, Ms. Mary Fenner and Ms. Pat Boga. Ladies.
Good evening.
Good evening, everyone.
Okay, I am Ms. Pat Boga, Applications Administrator and Navigator with Get Cover Mississippi and Healthy Kids Mississippi, Oak Hill Regional Community Development. And of course, we are happy to be with you this evening and excited about this week's edition of this month's edition of Ask Mary and Pat.
Hi, my name is Mary Fenner, and I'm a application assister and a navigator also with Oak Hill Regional Development Corporation, and we are happy to be with you this evening.
Okay, well, we do have some guests that will be joining us, and we will introduce one of them shortly. But I see that we do have some questions, and Ms. Fenner, I'll go ahead and get the first one started.
Okay.
Okay, and it says, is it official that pregnancy Medicaid will now cover up to 12 months of postpartum after babies are born rather than just 2 months? And I'm really excited about saying it is official. That's right. The postpartum extension went through the House and the Senate recently, and it was approved.
Okay, that's excellent. That's excellent.
Yes.
Okay, here's another question. I've read that the public health emergency that was in place since March 2020 due to the COVID-19 is ending the end of this month. When will Medicaid CHIP renewal start back up? Okay, we have been informed by CMS that the Medicaid CHIP unwinding of the public health emergency will start April 1st, 2023. You need to check with your local office, Medicaid office, or watch and wait for mail or email from your Medicaid office letting you know when your renewal will be completed. If you need any assistance, our application administrators will assist you. You can give us a call at 662-298-3584, and we can assist you with renewing your Medicaid or CHIP application.
Yes. Okay. If I receive a letter from Medicaid office letting me know that my renewal is in effect now, well, actually it's in progress now. Okay, let me read it right. How long will I have to respond to the letter or communications? Okay. Now, normally you have at least 30 days to respond and get your requested information in, but it could be between 30 to 60 days. Make sure, for one thing, make sure that you check your mail, email, or answer your phone for communications from Medicaid to be sure. And of course, on your letter, they should have on there how long you have to get your information in.
Yes. Make sure you check your letter.
Yes.
And sometimes they're requested within 2 weeks. Sometimes it may be extended out further. And we're not really sure with this unwinding how the process is going to take place. So please watch for your mail. Sometimes they'll call you and let you know what is needed and when you need to submit it. So please check your mail, answer your phone. Okay. What are my options if my income exceeds the maximum allowed for my children to continue to receive Medicaid after the public health emergency end date? Your children may qualify for other programs such as the Affordable Health Care Act, healthcare insurance through the marketplace. You can give us a call if your children are no longer on Medicaid, and also some adults, if you also have been taken off of Medicaid for whatever reason. You can give us a call at 662-298-3584, and you can speak with a certified navigator to help you look at different plans and also to help you get enrolled if you qualify. You also can log on to healthcare, www.healthcare.gov, to check out plans and enroll. But we are available to assist you in any ways. And if you do not qualify for the Affordable Care Act health insurance, there's also the federally qualified health community centers that we can refer you to, where you can pay on a sliding scale to get the assistance that you need for yourself and your children.
And also one of the things, you may have an idea that you're not going to qualify because your income is over the limit, but there may have been a decrease in your income. So make sure that you submit all your information to be sure. Okay, we have another question. Okay. Oh, what is so special about Affordable Care Act health insurance? Okay. The 13th anniversary of the Affordable Care Act was celebrated last week. It came into law in 2010, and it has been they've been able to help a total of 40.2 million Americans gain quality, affordable health care and insurance, and lowered health care costs for families, and provided critical coverage of services like cancer detection and mental health treatment. The numbers increased on Americans with insurance after the Affordable Care Act was introduced. Okay, people were insured that would not otherwise have been able to get affordable insurance. And these are just a few things that make it special. Okay, and we do have, I see that one of our fellow navigators, Sister Brenda Wilson, is on the panel. So if she has something to add to that, what makes it so special, Miss Brenda?
Yes, can you hear me?
Yes.
Okay, one of the things that make it so special is that if people have pre-existing health conditions, you're not denied coverage. And you have full essential benefits. And some of those benefits you will get, like preventive care, you have no charge, even if you haven't met a deductible, if you happen to have one.
Okay.
That's excellent about the pre-existing conditions, because most insurance companies, they will not cover your pre-existing conditions. But with the Affordable Care Act, that's one of the things that they do. They'll cover the pre-existing condition.
Yes, that's wonderful. Yes, because we know a lot of people have health issues, and there's some generalities about certain populations, certain ethnic groups that have certain conditions. So that is one of the main features that I think would be great for people trying to get onto healthcare through the marketplace.
Okay. Thank you.
Okay. Our next question is, how do I find a provider list for primary care physicians or other healthcare facilities for my children, such as dentists, optometrists, specialists, etc.? You can go online and check with www.healthcare.gov to search for or to find a provider. If you receive affordable healthcare insurance or interested in enrolling, you can also reach out to a Get Covered Mississippi Certified Navigator to assist you at our office by calling 662-298-3584. And if you need assistance with finding a provider for your child or children that receive Medicaid or CHIP, you can search the web at insuredkidsnow.gov to find a dentist in your community, vaccine outreach materials available, also mental and behavioral health resources. So there's always resources or places for you to look for resources for the information that you may need to help your child or yourself with your medical or health issues or needs.
Right. I believe we'll take a commercial break at this time. We're going to introduce Tish when we come back. And of course, if you have questions, you want to place them in the chat, feel free to do so.
Or on Facebook as well.
There are Mississippians applying for health insurance that may not qualify for a program. However, we all know it is important for families to have health insurance. This is why Healthy Kids Mississippi has been working with our state's federally qualified community health centers, or FQCHC, to help our fellow citizens find a medical home. Our organization is focused on raising public awareness about health coverage options for children and their parents through the Medicaid and Children's Health Insurance Program, or CHIP, in the state of Mississippi. Our process is simple. Our organization's assisters seek out Mississippians. Once our assisters gather the necessary information from the consumer, they apply for insurance programs on behalf of them when consent is given. When the application process is complete, the applicant will find out by mail if their application has been approved. We want to help as many families in Mississippi as we can. To learn more about our organization, please visit us on our website, healthykidsms.org, or give us a call at 662-298-3584. We welcome you.
Thank you. Thank you. We're back, and we do have one more question before we introduce Tish. I've been hearing about coverage to care. What is it? Okay. Coverage to care helps individuals to understand their health coverage and connect to primary care and preventive services that are right for them, and so they can live a long and healthy life. Some resources and ways to make the most of your health coverage are preventive resources, roadmaps to better care, roadmap to behavioral health, and also to help with your healthcare costs, enrollments, toolkits, and partner toolkits, and also community presentations. You can visit www.cms.gov/C23, the number 2, C2C, excuse me, for more information on coverage to care as well. Okay.
So are we going to introduce Tish now?
Okay, we can go on to the next question and then.
Okay. Why is it so important to utilize preventive services? I go to the doctor when I get sick and take my children when they get sick. Okay, it is very important to have various health screenings, dental screenings. They help you take care of you and detect problems before they start, or at the start of them. Most screenings through Medicaid and CHIP are free. Also, it's better to be preventive than try to take care of a situation and end up going to the emergency room, which we all know is more expensive.
That's true.
If you have health care now, you can take your children on regular visits. If something pops up, then you can make an appointment with your primary care physicians instead of having to have a whole, a lot of out-of-pocket costs, which can be prevented. Okay, we have Tish Dean with us this evening. She's employed with Oak Hill Regional Community Development Corporation, and she can share some information with us about preventive services and more. She also works with the Head Start program in our area.
Right, and Tish can kind of give us some more information on what she does as far as the Head Start employee and helping the parents with the health screenings and preventive services as well.
Good evening.
Hi,
Good
Tish.
evening, Tish.
Hope everyone's doing well today.
Yes.
So I'm just going to speak a little bit about what we do at Head Start. I've been at Head Start quite a few years now, I think going on 18 years. And I'm also an assistant and a certified navigator with Oak Hill. So just going to give you a little bit of, what I have. So first I'm going to start off with how the children and the families come into Head Start, and we basically immediately start addressing the health portion of what Head Start does. So first off, they have to have an up-to-date immunization to be, enrolled, to sit in a seat. And then the immunization, they have to have the up-to-date Mississippi Form 121. That has to be on record and up to date. Okay, so once we have all the necessary information during the registration process, we basically do intake, and we get to know the families and find out if there are any health, history needs that we need to know about and address through Head Start. But we also determine during that time if they have a medical and dental home, a primary care provider. So that's a very important thing. And one of the things that I do in our health services area is I set up partnerships with doctors, dentists, and other specialists. And we have that information ready during registration. And if they come in and they don't have a medical or dental home, then we usually have someone, a clinic or dentist in pretty much all the areas, who we can say, okay, well, they partner with us. You don't have to use them, but they will provide services to you, and they can become a medical or dental home, because we want you to have care even after you leave Head Start. So a lot of families come in with the primary care providers, some of them don't, and so we have that we can offer. So, and of course, just like you said earlier, if they need to contact through the website for Medicaid or CHIP, they can also find, primary care and medical homes, that way also. We during enrollment, well, let me step back. We give the parents a medical and a dental examination form that they can take to the provider and have it completed and have that service done as preventive. Everything that we're trying to do, we're trying to see if there's anything there that may not have been addressed before. And, we can move forward and try to help you, do what needs to be done to correct the situation or help the situation. So they'll take the form to the provider. And as far as the dental, they're going to get a thorough dental exam. And if it's found that they need some sort of treatment, then we're going to help them secure that treatment. So we're going to address it from the beginning and hopefully all the way through the end before they leave Head Start. With the medical portion of it, the doctors are going to check everything from their blood pressure. Children, the Office of Head Start mandates that children have a lead exam, a blood lead test by a certain age or whatever. And if they haven't had one prior to coming to Head Start, then during that medical exam, when they're doing their initial medical exam, the doctor may also do that, as well as a hematocrit or hemoglobin blood test, so that we're checking to see if they may have an iron deficiency or anything else that might show up during that time. So we're just trying to hit it from all directions, so we're just trying to make sure that child is healthy, because a healthy child is ready to learn.
That's right.
So we're right. All right. So once they get the physical and dental, and if anything comes up, then we address that. And that is supposed to be done. Another, Office of Head Start mandate within 90 days of enrollment. So we do have time frames and things that we have to follow in order to encourage these families to get this done. We also do growth assessments, on the children. height versus weight. And if anything comes up as an unhealthy weight, whether it's overweight or underweight, we just say unhealthy weight, then that family is referred to the nutrition department and information is provided to them on, healthy eating and things like that. So we're just trying to address it all. Let me see what else. Any follow-up treatments or anything like that, the Head Start staff reaches out to the family and tries to make sure that they're getting all the necessary follow-up treatments, making their appointments. And we're, promote toothbrushing as well. We currently don't brush do the toothbrushing at the center, and that started when COVID happened. But we do provide toothbrushes and toothpaste to the children that we send home.
Okay.
So we encourage toothbrushing as preventive. We want help, get clean teeth and no cavities, hopefully, Head Start also performs developmental, sensory, and behavior screenings on the children. And that's part of our 45-day, 90-day and 45-day mandates from the Office of Head Start. And that includes vision exams, hearing screenings, and a lot of times we're fortunate enough to have providers come to the Head Start Center and do this, which takes some of the burden off of, the parents trying to get some of these things done. Because, if you go into the dentist and you go into the doctor, then you got to go here to the ENT or the, or the optometrist or, whatever. So we're fortunate enough to have those community partners who step in and really, really, really help Head Start.
That's great.
So altogether, Head Start is just trying to address any and every issue that will help that child be ready to learn and thrive and just do the best that, they can possibly do. We go off the mandates of the Office of Head Start, Mississippi Child Care requirements, CDC requirements, and we also have all Head Start organizations are required to have a health service advisory committee. That's also part of what I do, is interacting with the health service advisory committee. We have optometrists, we have dentists, we have pediatricians, we have nurse practitioners, we have behavioral health, we have the registered dietitian that we come together twice a year. They give us recommendations and updates. We inform them of things that we're trying to do in Head Start, and they say yay or nay, and we just kind of go. We have different organizations that play a part into what ICS and different Head Start organizations require and ask the parents to do. So, in the way this all ties back to Oak Hill. Okay, so we know none of this is free. so the dental exam, the medical exam, dental treatment can become very, very, very expensive. There are families that come to us who have no form of insurance, no Medicaid, no CHIP, and no private insurance. So with this collaboration with Oak Hill, we've learned so much about the importance of that coverage, whether it's the ACA or whether it's Medicaid or CHIP. So if we find out during that intake process that the family doesn't have any coverage, of course, Head Start does what it can to assist. But if that family can get Medicaid or CHIP and cover, dental treatment can go up into the thousands, plus possible hospital or anesthesia bills. So we want that family to be covered, and we want that family to be covered once they leave Head Start. So if we can help them secure Medicaid or CHIP, and they're going to carry that and do their renewals every year, even on past Head Start, all the way up to age, 18, 19, hopefully, if they qualify. So we try to keep them on there to adulthood if they qualify. So basically, that's just, what I do and how all of it just ties in together. It's building healthy families, building healthy communities, and because Head Start and Oak Hill are both, community oriented. we're reaching out to the communities, we're reaching out to the families, we're reaching out to anybody who will listen, about the good things that happen with Head Start and with Oak Hill. How can we help?
Right.
How can we help? So that's basically, what I have on Head Start and the collaboration with Oak Hill and how it all ties in together.
Yes. And we thank you so much because we're talking about, again, coverage of care and preventive services. And it's apparent that it starts when they're small,
Mm-hmm.
when they're, 2-3 years old.
Mm-hmm. Yeah,
And
well, we also have early Head Start that starts at a few weeks old. It's like birth to up to 36 months. So early Head Start, it starts there. If they get accepted in the early Head Start, it starts very early for us.
okay, and
So
do you do the screenings? You set up the screenings and doctor's appointments with them as well?
we can assist. We encourage the parents to do it, and most
Okay.
providers want the parent presence at the appointments, and because parents have to sign off on a lot of consents and things that we're not allowed to sign off on for them. So basically, we encourage the parents to work and try to get this done, but we'll assist them as much as possible. If there's anything that we see, we reach out to the parents and we try to follow up. That's what we do. We want to make sure that child really has a head start, a head start at life. So, and Head Start at success. So it starts at birth, basically, and we keep them on to hopefully until they turn 5 or are transitioning on to kindergarten.
Yes.
Mm-hmm.
So being healthy actually helps you to learn better.
Absolutely.
We've got so many parents that say, we've even had questions, why do we need to take them to the doctor for preventive services when, we take them when they get sick. So you just shown us.
Yeah. Yeah. And that home, that primary care, we don't want to make the emergency room our primary care. We don't want to get to the emergency room. We want to have primary care that's going to keep us on the right track. And hopefully, we don't have to have those kind of visits and things like that,
That's correct.
Mm-hmm.
That is so important. And you have given us such great information. And that's a true example of coverage to care. How we here at Oak Hill, we partner with the Head Start in order to get make sure the children have what they need. If they get a healthy start in life, that helps them on until adulthood. And that is so excellent. That is great. That is great information. A lot of things that you did that I didn't even know about. And so I'm sure a lot of others don't know as well. So that was great.
Thank you.
Thank you so much, Tish.
Thank you.
You're welcome.
All right, we'll take a commercial break and we'll be right back.
Congratulations! You have successfully selected and enrolled in a marketplace plan. Choosing the right health plan can be overwhelming, but it is important for you to know that the next steps are just as critical as selecting the actual plan. This is why we created this video, to guide you through on how to get the most out of your health insurance coverage. When open enrollment ends, the period known as From Coverage to Care begins. It is an initiative championed by the Centers for Medicare and Medicaid Services, or CMS, to help consumers with new health care coverage understand their benefits and connect to primary care and the preventative services that are right for them so they can live long and healthy lives. Ask yourself questions like, is there a time when I thought I should go to the doctor but didn't? Was it because of the cost? Was I afraid of finding a problem and how much it would cost if I did? Well, finding out early is better for your health and your pockets. Having health coverage relieves the stress of finding and affording healthcare services when you are sick. It is important to familiarize yourself with common health insurance terms. Terms like premiums, co-payment, deductible, and others. This will help you understand the differences between health coverages. After you understand the terms, it is a good time to learn about the different financial assistance options that are available for you, like premium tax credits and cost-sharing reductions. Once you have a basic understanding of health coverage terms and options, it is important to log into your account with your new health insurer provider so that you are able to pay your monthly premium. In your account, you will also be able to view your policy benefits, activity and usage, your ID cards, and also the ability to participate in telehealth. It's important to know where to go for care. Find a DR before going to the ER. By logging into your account and searching for providers in your network, you will eliminate the hassle of going to an ER. Finding the right provider for you is essential in maintaining good overall health. You may want to visit a few offices to make sure you and your primary care provider are well suited. Be prepared for the visit by bringing ID cards, records of your key information, including medical conditions, dates of past surgeries, current medications, doctors' names and contact information, next of kin and contact information, and any drug allergies. During your visit, it is important to be open with your doctor. Asking questions is key to good communication with your doctor. If you don't ask questions, he or she may assume you already know the answer or that you don't want more information. Don't wait for the doctor to raise a specific question or subject. He or she may not know it's important to you. Be proactive. Ask questions when you don't know the meaning of a word, like aneurysm, hypertension, or infarct, or when instructions aren't clear. For example, does taking medicine with food mean before, during, or after a meal? Now that you have a general idea, it is important to remember to make sure you pay the monthly premium and also continue to make appointments and fill prescriptions. Here at Get Covered Mississippi, we are always ready to assist you. Please give us a call at 662-298-3584 or text us at 662-689-9712. Email us at info@getcoveredms.org or visit our website at www.getcoveredms.org.
Thank you, Duke, and we want to thank Tish so much. We also see that another one of our coworkers has joined us, May Stigler, and we just want to thank her for joining us today, and we will allow her a chance to share some input whenever she feels like it. Okay, Ms. Finner, can you take the next question?
Okay. My two oldest children, 20 and 21, will lose their Medicaid after the public health emergency ends with Medicaid. Both of them have to go to the doctor on a regular basis. I don't know what to do after the Medicaid, if the Medicaid is cut off or after the Medicaid is cut off. We are here for you. We are here to help you. We can talk you through it. We can go over different plans that may be available through the Affordable Care Act with them so that they may be able to get further health insurance coverage. Also, there's the federally qualified community health centers that we can refer you to. We have someone on staff with us that can assist you with that as well, with referring you to the federally qualified health centers. So there's always something that we can assist you with, and we will try our best to make sure that you get the services that you need, either through the Affordable Care Act health insurance, referral to the federally qualified community health centers.
I know you said that you could refer us to the federal healthcare center, but what if my children is not employed? Is there any program out there for them?
Okay, if they're not employed, if they're still at home, then they may be still being carried or taken care of by their parents. So their parents' income may help with them getting health insurance, or also going to the federally qualified health centers. It's on a sliding scale
Okay.
for a person to be able to get the type of insurance or health insurance that they may need. So if that doesn't work, we'll try to work with you the best that we can in order to get the assistance that you need.
Okay, thank you, Ms. Fenner.
You're welcome, Ms. Stigler.
Yes, and we do have other community resources that we connect with. So as Ms. Fenner said, we really do. We go out of our way to try to make it happen for you. And of course, we're about to experience, the 19-year-olds and those, well, actually some that are older. They may have been 19 right after May of 2020, but now they may be 22.
Right.
And unless they have small children and meet the MAGI income, they will be terminated. So we are getting prepared and ready to assist them in any way we can. Miss Brenda, she has her
Yes.
hand raised.
What I was going to suggest to parents is this: if you know when usually that renewal date is happening when you first enroll, that month of enrollment. So therefore, if they want to go ahead, we can do what we call using the window shopping tool, take your income information, household occupancy, and we can show them estimates of what they can expect in the marketplace.
Okay.
We can do that ahead of time.
Okay, great. Great. Thank you. Okay. Duke will take another commercial break, and I see we have another question. We'll see if we have any others in the chat and also on Facebook when we come back.
CHIP has established itself as a critical piece of the federal state response to children's health care needs. CHIP, signed into law on August 5, 1997 by former President Bill Clinton, was created to build on the success of Medicaid by giving states the opportunity to receive enhanced federal matching funds to expand affordable health coverage to children and families that earn too much to qualify for Medicaid but too little to afford private health insurance. Over the past 25 years, CHIP and Medicaid have sharply reduced the rate of uninsured children in the U.S. Together, they have successfully kept children connected to health coverage and played an important role during recent economic downturns and public health emergencies in the state of Mississippi. The Children's Health Insurance Program provides insurance coverage for uninsured children up to age 19 whose family's income does not exceed 209% of federal poverty level. Families may earn up to 209% of the federal poverty level and be eligible for CHIP. A child must be determined ineligible for Medicaid before eligibility for CHIP can be considered. Children with current health insurance coverage at the time of application are not eligible for CHIP. Our organization, Oak Hill Regional Community Development Corporation, is focused on raising public awareness about health coverage options for children and their parents through our Healthy Kids Mississippi initiative. To learn more about our organization, visit us on our website, healthykidsms.org. Give us a call at 662-298-3584 or text us at 662-689-9712. We are always ready to assist.
Thank you, thank you. And I do see that we have one more question, and I believe it was from the same person with the talking about the two oldest children. Okay, now this one says, how soon will my two oldest that will lose their Medicaid after the public health emergency of this month? Okay. How soon will they lose it? Okay. Well, actually, the public health emergency ends at the end of this month, and they will start working on those cases as early as March 1st. They may have already sent some letters out. So the public health emergency, again, it will end the end of this month, and there's no definite date right now as to when you will hear of your child, your two, if their case will be closed. But Medicaid will be sending a letter out or an email letting you know. And so what you'll need to do is please, just be on the lookout for those letters. Watch your mail for something from Medicaid, and make sure you check your emails as well, okay? And your effective date of closure should be on that correspondence. And again, that letter could go out anytime, so you just really need to start watching your mail and just make sure that Medicaid has your current address, because if they send it to your the address that you have on file, and that's no longer your address, now that letter is going to go back to Medicaid. And even with your younger children, if they have to be renewed, now if that letter goes back, now they may give you a call, they may give you a chance, give you a call, but you know, they may not. So just make sure that you contact your local Medicaid office and give them your correct or updated address and contact information.
Right, it's very important that you do give them your updated information, because if they cannot reach you, it's a possibility that they will cut you off without you even receiving a renewal letter or letting you know that Medicaid is about to renew, because they did the initial contact and the letter came back. So that means that you're no longer available. So what they may do right away without even trying to do a phone call or check is just cut you off. So if you have moved since 2019, or your phone number has changed, your email has changed, just give your local Medicaid office a call and give them your updated information.
And when you receive your letters to renew your children's Medicaid or your family's Medicaid, and if you don't have transportation, if you're working and don't see where you can get off work and make it to your appointments, you know, you can always call us at Oak Hill Regional Community Development Corporation. We can assist you over the phone, and all we will need is your consent to complete the application with you. And again, we can help you. Now, the only thing is you'll have to get your income verification and what other information Medicaid might need. You'll have to get that in, and we could even assist you with that, right, Ms. Finner?
Oh, yes, we can. If they request information from you and you need to drop it off at the office and you're not able to get to the office, we can drop it off for you. And we have done it in the past. I know my screen has frozen, but can you guys still hear me though? Okay.
Yes.
But we have done it in the past. We'll drop the information off for you, whatever they need, check stubs. And you say, I have my check stubs, but I have no way to get them to them. You can email them to us, or you can drop them off at our office, and we'll make sure that the Medicaid office get that information, because our goal is to keep people on Medicaid. That's our goal, is to keep people on Medicaid and CHIP.
Right.
We do not want anyone to lose their coverage. So we will go to we'll do whatever we can to make sure your children stay on Medicaid and CHIP.
Right. And we have assistants and navigators all over the state of Mississippi,
Yes.
all over the state of Mississippi. So all you have to do is call that number, 662-298-3584. And you can just let them know that you're looking for someone to assist you, and we will be right on it to take care of you.
Right. We'll refer you to someone in that area that you live in. You might have a relative, someone that lives in Biloxi or other parts of Mississippi. We'll be able to, we have sisters in those areas as well. So if you talk to someone or your relative and they say, well, Medicaid got cut off or what I need to do, you can call this number and we can refer you to someone in that area that will be able to help you or assist you with your whatever your healthcare needs are.
Right. Okay, I just got a message that there was a question in the chat. Do you see it, Duke?
Checking now.
Well, actually on social media. It says on Facebook.
All right, it says, do you think persons should check their spam as well when checking your email? All right, it says,
Most definitely. I just recently, I was looking for some very important mail and I kept saying, I haven't received it. I haven't received it. And then when I called the party, they told me to make sure that you check your junk mail. And there it was. Most definitely. Check that junk mail, that spam mail. And don't start deleting before you check it. Okay. Do we have any other questions? Comments? Okay, well, we're going to turn it over to Duke. And we thank you all so much for joining us this evening and tuning in. And we look forward to you joining us on next month.
Unmute. D.
oh, wow. Okay. Okay. Everyone hear me now?
Yes.
All right. Great job as always, ladies. You guys continue to do such an amazing job each and every month. And you guys continue to bring in new guests. And they also give valuable information. And great job, Ms.
Yes.
T, giving some well-needed information.
Yes.
Everyone took their notes. And if they didn't, they're able to go back on our social medias and just check in and write down any other notes that they may want, and maybe write down some questions for next month, because our next month's Ask Mary and Pat show will be April 24th at 6 p.m. Again, that is April 24th at 6 p.m. A few more updates. Our next third Wednesday Parent Resource Chat will be Wednesday, April 19th at 11 a.m. We will let you know on social media on what that topic will be. You may learn more about us at www.oakhillregionalcdc.com and www.healthykidsms.org. You can contact our office at 662-298-3584 or text us at 662-689-9712. And Ms. Finner, what is your extension for the office number where people can reach you?
My extension is 107.
Ms. Bogle, what's your extension?
And mine is 109.
All right. So if you need to contact Ms. Finner or Ms. Bogle, you can call the office 662-298-3584, extension for Ms. Finner 107 and 109 for Ms. Bogle. Once again, we acknowledge our board chair, Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. This has been a production of Oak Hill Regional Community Development Corporation, belonging, building, and bridging in the Mid-South region and across the state of Mississippi. Have a great evening, everyone.
Thank you.
Thank you and bye. Have a good evening.